I always love ARUK. It's one of my favorite meetings. And I mean, there are two things that I really like about the meeting generally. The first is that there are no parallel sessions. So you sit in the whole thing. And I think that's kind of the best way, because there might be something on the program where you think, well, it's not super relevant to what I do. And then you hear the talk and you kind of start to build links, which you wouldn't do otherwise. And also the ARUK network is really something that I look forward to about the meeting, seeing the kind of same people each year to catch up. Obviously, it's been a bit different this year, but it's still been nice to kind of see on Twitter everyone talking about the meeting and still those kind of connections being maintained. From the sessions, there were a few things that I really enjoyed. I particularly liked the viruses and dementia session, and hearing about some of the overlap in the risk for Alzheimer's disease and the risk for severe COVID, I thought was quite fascinating. And obviously that ties in more to the mechanistic work that was presented in the inflammation session of how the inflammatory response we realise is more and more important in disease etiology. And I also really enjoyed, I think it was the first session about drug development, and kind of hearing a bit about how we can think about the very preclinical stuff that we do in the lab and think about it in kind of the perspective of translation, which is obviously the aim for all of us in the end, is to get kind of these in the preclinical to clinical pipeline.